Welcome. Thank you for joining us today. My name is Helen Liu, and I'm the Programming and Partnerships Manager at Cary Library. This event is also presented in collaboration with the Lexington Human Services, MGH-West, and Supported Living Incorporated, which is a nonprofit organization helping people with neurological disorders. And we're also thankful for the Community Center for allowing us to share their space and present this program to you. In this workshop, physical therapist Meredith Conroy will educate on the sensation changes encompassed with the diagnosis of neuropathy. Meredith will discuss the effects of balance, strength, and mobility, as well as tips for functionality and avenues of care. I'm going to pass the mic to Meredith, who will introduce herself and start the program.
Hello. My name is Meredith Conroy. I'm one of the neurophysical therapists over at MGH-Waltham. So I work a lot with patients that have balance concerns or different neurological conditions like Parkinson's, MS, ALS, the whole gamut. I felt inspired to do this particular talk because I would say a solid 50% or more of my patients coming in have a comorbidity of neuropathy, and it really can affect people's balance, and people tend to have a lot of questions about it. So I'm gonna go through what neuropathy is, how it presents a lot of the times, different ways that it's diagnosed, and what we can do from a physical therapy standpoint. I'll have a Q&A at the end, and we'll just get right into it. All right. Neuropathy. Okay. So neuropathy is defined as a disease or dysfunction of one or more of the peripheral nerves, so outside of the brain or spinal cord. There's a lot of different types of neuropathy. Primarily in this presentation, I'm going to be talking about peripheral neuropathy, which is the most common that you'll see, but I just figured I would mention some of the other ones while we're here. So peripheral neuropathy is the classic kind of like stock and glove neuropathy, where you have changes in sensation in your hands and feet, and typically works its way up your limbs. There's also autonomic neuropathy, so it can affect nerves that control things like heart rate, digestion, cardiac function, bowel and bladder movement, things like that. Focal neuropathy, so that would be if you had one single nerve that was affected, things that come to mind like a carpal tunnel syndrome, cubital tunnel syndrome, where it's just one isolated spot. And then proximal neuropathy, which is less common, but tends to affect the nerves closer to your torso. So things like Guillain-Barré, which again is more rare. But we're going to be focusing on peripheral neuropathy in this presentation. So in order to understand neuropathy, it's important to understand that we have a lot of different sensory information that goes into the brain. So throughout our body, there's a number of different types of cells that detect different types of stimulus. And so they can feel things like vibration, sharp, dull discrimination, 2-point discrimination, temperature, pain, light touch, deep pressure, proprioception, which is your ability to feel where your joint is in space. And so if you have neuropathy, not all of these cells are going to be affected to the same extent. Something that I see often in the clinic is people might have an impaired ability to feel vibration, but then their ability to feel, proprioception is totally fine. So you might have some things that are affected and other things that are not. And then, so sensory peripheral neuropathy symptoms. So these are things like numbness, tingling, burning, or maybe excessive sensitivity to touch or pressure that shouldn't necessarily be painful, but is. Sharp burning pain and balance impairment. And there's also a slew of motor neuropathy symptoms. So the things that you'll see are weakness, lack of coordination, maybe some muscle atrophy, abnormal muscle twitching, and balance impairments. So typically when people have weakness because of peripheral neuropathy, you're going to see weakness more so in the ankle muscles. So things like difficulty picking the toes up all the way, or difficulty coming up onto your tippy toes. And that's particularly important because Your ankles are your first line of defense with balance. They're always making little corrections to keep you stable when you're standing and walking. We'll talk a little bit more about that later on. So diagnosis. There's a lot of different ways that you can diagnose peripheral neuropathy. A lot of times people will be given the diagnosis just based on a subjective history. So someone coming in saying, yeah, I have numbness and tingling in my hands and feet. But there's a lot, you can do more specific studies to rule it in or out. An EMG is a type of nerve conduction test. Not the most pleasant test in the world, but basically they'll stick needles in different spots on along your limb, and they're testing to see how well your nerves conduct electrical signals from their timing, how fast it takes from a signal to go from one needle to the next. Imaging can be done to see if you have any type of like compression, maybe like at your spinal cord level, or if you have like a compression somewhere more peripheral, like outside of your spine. Blood tests won't definitively say yes or no, you have neuropathy, but they can show whether you have like different vitamin deficiencies that are associated with neuropathy. It can check for abnormal blood sugar levels, inflammatory markers, and all of these things can be caused and associated with neuropathy. Less common, skin biopsy to test to see like the number of nerve endings present in a given sample. And again, less common, but a nerve biopsy itself, but to look at the nerve more closely, see if there's any type of damage that would explain a neuropathy diagnosis. People always ask why it happens, and there are a lot of different things that can cause neuropathy. We're not going to touch on all of them today, but diabetes, idiopathic, which means we don't really know why it happens, but it happens. Chemotherapy or drug-induced neuropathy, alcohol-induced neuropathy. So that's like if you have, you know, like years of alcohol abuse, people can sometimes see sensory changes in their limbs. Different autoimmune or inflammatory conditions, infection, traumas like a major injury to the area that causes nerve damage, vascular disorders, and vitamin deficiencies. We're going to talk about a couple of these that I've starred. I don't want to get too hung up on the details of some of these, but I figured it's important to address. So first and foremost, idiopathic. I would say most of the people that come into my office have been diagnosed with idiopathic peripheral neuropathy. So it accounts for around 20 to 30%, according to some sources. I've seen statistics saying 30 to 40% of cases. So idiopathic is a fancy way of saying we don't really know why it's happening, but it's there nonetheless. I mean, my theory with this is there usually has to be something causing an issue, but I think there needs to be a little bit more research in this area to figure out what different factors might contribute to neuropathy. But that's an answer that you get a lot of the times in the doctor's office is we don't know why it happened, but it happened. Diabetes is another huge one, and so why does diabetes cause high levels of peripheral neuropathy? So it can obviously lead to changes in your blood sugar levels, and over time, high blood sugar causes damage to the blood vessels that support nerves. And when the blood supply is diminished, the nerves don't get the nutrients that they need, and so they get damaged and they die. Chemotherapy. So I see this a lot of time in clinic too. Someone will have chemo-related neuropathy. The interesting thing about chemo-related neuropathy is that a lot of times their sensation does come back, and that is not always the case for other types of other things that induce neuropathy. But the reason chemotherapy can induce neuropathy, there's a couple different mechanisms of action. I don't want to get too hung up on the details, but just to give you some broad strokes, different types of chemo drugs can activate glial cells, which are a type of nerve cell, which then activate the immune system that releases inflammatory molecules. These inflammatory molecules then lead to inflammation in the nerves, which then causes breakdown of the nerves. Another way that it can cause damage, it causes mitochondrial damage, so damages within the cells themselves, which lead to enzyme, protein, and fat damage within the nerve cells, as well as a dysregulation of calcium, which can then lead to neuronal death. And then also certain chemotherapy drugs can alter different ion channels like sodium, potassium, TRP, which again then causes damage within the nerves. Different autoimmune conditions, so things like MS, type 1 diabetes, lupus, rheumatoid arthritis, Hashimoto's. So autoimmune conditions occur when the body mistakenly identifies its own tissues as foreign and tries to attack them using immune pathways. So this type of attack can happen to the nerves themselves as well, which leads to tissue damage and death, which in certain conditions can lead to neuropathy. So at the cellular level, when I say tissue damage and death, what I mean is the nerve itself. You have in a normally functioning neuron, we have a nice myelin sheath that goes around the axon and it's perfectly intact. But when you have nerve damage, the myelin sheath can get damaged. And what that does is it impedes the speed at which signals are sent down the axon, and it impedes the communication between nerves. And then, after a certain point, you'll also get axonal death. So the actual nerve tail itself, so to speak, will get damaged and not send and receive nerve impulses as well. Feel free to sneak on by, sit wherever you find a spot. So, how does all of this affect balance? So this is primarily where I come into play. So we have three primary systems that give our brain information that helps us maintain our balance. So we have our vision, our vestibular system, so our inner ear, and our sensation. So our sensory system is constantly sending signals to our brain to tell us, where we are in space and how our bodies need to subsequently react. When our nerves are unable to send sufficient information to our brain, telling our brain where we are in space, our brain doesn't know how to react. And so it's harder for us to respond accordingly. I'll get more into that in a little bit. So sometimes both sensation and motor function are impaired with neuropathy. So not only do you have the lack of sensory information being sent to your brain then tries to, send a signal to your body and your muscles to tell it to react in a certain way. And sometimes the weakness that you have in muscles can make a balance reaction not quite as strong. So like I said earlier, the most commonly affected muscles are the dorsiflexors and the plantar flexors. So the muscles that lift your toes up off the ground and push you up onto your tiptoes. These muscles are responsible for ankle mobility as well as balance corrections. What you're going to see a lot of times in terms of the way that patients walk when they have neuropathy, there's a few classic signs. So tend to have a wider base of support, shorter step length, maybe decreased heel strike and push off. So what that means is maybe not landing with your toes up in the air quite as much and not, pushing off as well. And then you might see an overcompensation with hip flexion, meaning, if you're not able to pick your toes up as much, you might end up picking your feet up a little bit higher as you walk and walk with a little bit of a wider base. And you're going to see people slow down. So I always tell people if they have a tough time, like understanding why someone walks the way that they do with neuropathy, is imagine what someone's going to do without a balance problem when they're walking across a sheet of ice. So they're going to widen their base, they're going to take smaller steps, they're not going to pick their feet up quite as much, they're going to slow way down.
Are those all good things?
What's that?
Are those all good and safe things?
It depends. So you want to be like slowing down if you're not able to make quick corrections and you don't have the reaction times that you need. So I don't want anyone to ever be like reckless with how fast they're going. But if people have a lot of weakness in their ankles, like it can lead to tripping and like your toes getting caught when you're walking. So sometimes if that's the case, different like braces need to be used to help prevent the toes from catching. And there's different exercises that you can do to kind of work on the gait mechanics that we'll talk about a little bit later. So treatment options for neuropathy. There's not a lot of times when neuropathy is present, there's not a ton that you can do to change the actual sensation. But there are different things that you can do if there's a lot of pain from the neuropathy. So NSAIDs like Advil can be helpful. Anti-seizure medications can be helpful because they're kind of nervous system depressants. Topical treatments like different creams. And actually some antidepressants can be helpful with reducing nerve pain as well. Different therapies that are available to help reduce pain again. So scramble therapy it's a type of electrical stimulation. I haven't seen it too much in the clinic, so we don't have it at MGH-West, but just so you know about it, it's basically electrodes that are placed kind of above and below the area that's affected by neuropathy. And it uses electrical impulses to basically diminish the amount of signaling that's being perceived from the damaged nerves. There is spinal cord stimulation to reduce the amount of signaling that's being sent to the brain from the damaged nerves. Sometimes different, if it's an autoimmune mediated condition, there's different types of infusions that patients will get. Surgery, if it's something like peripheral, that's like a peripheral compression that's causing the nerve damage, or if it's something like at the spinal level, if you have like a herniated disc that's causing neuropathy, there's different surgery options for that to relieve some of the pressure. And then physical therapy. So the goal of physical therapy is not to change the patient's sensation, because like I said, a lot of the times the sensation is not going to change. But the goal is to strengthen the other bodily systems that also contribute to balance to compensate for the sensory loss. So that might include functional strengthening, ankle strengthening and stretching, proprioceptive training, which is kind of a combination of ankle strength and mobility and inner ear or vestibular engagement. We're going to talk a little bit about that later on. Inner ear training, which we're going to talk about later on. Walking training in different environments like obstacle course, things like that. And then pure old balance training, reactive training. Again, sensation's likely not going to change, but patients can still improve their overall function, balance, strength, and mobility in order to reduce fall risk. A question that I often get when patients come in is like, do you think I'm going to make any progress? Do you think it's worth me coming here? If my sensation's not going to change, how is my balance going to change? I would not waste people's time and have them come in if I didn't think that they could make progress. So there's a lot of factors that contribute to someone's overall balance. Sensation is a piece of the puzzle, but there's usually other movable things that can be affected in order to improve someone's balance. And people do make progress. So strengthening. There's a lot of different, strengthening exercises out there. I've listed a couple functional ones in here. So standing up and sitting down from a chair. Lunges. Lunges are particularly important for like bending down to get things off of the ground. A lot of ankle strengthening. So we see this guy doing some calf raises and then some toe raises, things like that, just to get the muscles that support your whole body a bit stronger. Proprioceptive training. So proprioceptive training refers to training the brain to perceive where you are in space better. And the way that you can do that is by varying the surface that you're standing on. So you can do like a rocker board or a foam pad, a Bosu ball, which is a little like half ball, or standing on one leg. And then you can also vary whether or not someone's eyes are open or closed, and incorporating weight shifting, so shifting left to right, front and back, and really focusing your attention on, feeling where you are in space, and practicing that in different environments. Vestibular training. So inner ear training is a little funky. Your inner ear is responsible for telling your brain where your head is in space with relation to gravity. So it's constantly at work all the time. So one of the ways that your inner ear works is if you're looking at something and you turn your head, your eyes will automatically move the opposite direction of your head to keep things still and focused. If that reflex doesn't work quite as fast, things don't stay still and things can get a little blurry when you turn your head and move around. So working on training that reflex can actually be very helpful from a balance standpoint. It's common for this particular reflex to get deconditioned. And so working on it can help just train your brain to feel where you are in space a little bit better so that your brain can tell your muscles what to do and react accordingly. A lot of times too, if anyone has like a history of vertigo, they might be a little bit more sensitive to head movements or position changes, which can then certainly throw balance off when you're, walking while turning your head or bending over, looking up. So there are different habituation exercises, which essentially are designed to get your brain used to moving in certain ways so that you don't get dizzy with them. So that's a piece of the puzzle. And then gait training and balance training. So working on balancing in different types of environments usually incorporates a lot of different types of obstacles or stair work. So I use hurdles like the ones that are pictured here a lot of times because they forces you to pick your feet up a little bit higher. It works on single leg balance, weight shifting. And then you can kind of see it in the middle picture, but those are little stepping stones. And so it mimics walking on uneven terrain. And a lot of times when people come into clinic and we do stuff like this, they're like, well, you don't expect me to ever do anything like this outside of the clinic, right? And I'm like, no, I don't. And I don't want you to, but the goal is typically to challenge people more in the clinic than they would encounter in their regular life to get them feeling what those muscles feel like when they're firing and train their brain in clinic. And then at home, there's, much more mild versions of these exercises that work on, strengthening balance in a safe way. So, questions, comments, concerns? Okay. Strike
Vitamin B12,
yes.
it's good to take.
So I would consult your doctor with any concerns about medications, but yes, B12 is a big thing that when it's deficient, it can lead to neuropathy and tends to run low in a lot of people. So it's always good to get your routine blood work and make sure that that's in a good spot. Thanks, Water.
Are you going to talk about neuropathy in your hands also?
So a lot of our OTs work with neuropathy in the hands. It is similar to neuropathy in the feet in that smaller muscle groups tend to be affected. It tends to happen, working at the tips of the fingers, working its way up as time goes on. And a lot of our OTs will work with people that have maybe weakness in the hands or because of sensory changes, they have difficulty with buttoning things and stuff like that. So I'm not an OT, but I know that they work a lot with different putties and sponges to work on hand strengthening, and they'll do a lot of fine motor training. And there's a ton of adaptive equipment too for fine motor tasks that they train people to use as well.
Thank you.
You're very welcome.
Can nerves regenerate at all?
It depends. So if it's something from an injury, so you had a bad car accident or something and you had an injury to the nerve, they can regenerate. Typically it takes a long time, and typically if you don't see an improvement within a year, it's thought to be permanent nerve damage. So it's not always predictable whether or not nerves will recover. And how much they will recover. Sometimes people will improve a little bit, but not all the way. And sometimes they make a full recovery, and it's no problem. But it is very person specific.
Yeah. Does it get progressively worse usually?
It can, and which is why it's very important to see if you can figure out what the underlying cause of the neuropathy is and manage the underlying condition. So it's particularly important with diabetes, making sure that your blood sugars are well managed to help keep it relatively at bay. And same with like your other blood work and stuff like that.
Does the numbness or tingling caused by nerve compression the
Mhm.
same as what you talk about and the treatment that you talk about? Does it apply?
Great question. So
Could you repeat the question?
Oh, sorry. So she asked, is the numbness and tingling caused by a nerve compression, same as what I'm talking about? So a compression injury can certainly cause changes in sensation like numbness and tingling. Once you remove the compression, that type of sensation should improve. So it's a little different than like a type of neuropathy that's induced by, something systemic like diabetes causing damage to the nerves themselves. So it's a compression injury is a little bit more straightforward to treat.
If it cannot not be reduced.
If like it can't be
Yes,
changed,
cannot be.
then the treatment would be, from a physical therapy standpoint, then the treatment would be similar. Yeah.
I've seen a lot of ads for creams and things for neuropathy, and
Yeah.
now that you're speaking more about treating the pain than the tingling and
Yeah.
that sort of thing, are those creams effective to
For treating the pain or
the
tingling?
tingling? Now I'm thinking maybe it's just a pain
Mhm.
cure.
Yeah, I would say that the creams are more effective with treating like an underlying pain, like a sharp burning type of
Uh-huh.
sensation, not so much a tingling.
Sorry, man, can I have you standing in front of the computer because it's recording you? Big little face, thank you.
What are the medical specialists that one should consult? when you've Got neuropathy.
I would say a neurologist is a good person to go to. Now that being said, if the cause of your neuropathy is something like diabetes or like a chemo-induced neuropathy, then like your endocrinologist or whoever manages something like that would be more appropriate. But if it's just regular old idiopathic neuropathy, a neurologist would be a good person to consult with.
Also, could you talk about shoes?
Yes, okay, so different types of a lot of different people will recommend different types of shoes. I see Hoka's as being all the rage these days. I'm actually wearing them, but they're very, very cushiony. I tend to not recommend patients with neuropathy wearing shoes that are super cushiony because it's like walking on big pillows. And so if you already can't feel the ground, you don't want to add, a big cushy sole to the mix. So something with a thinner sole that is still supportive is very important. You obviously don't want your feet to hurt while you're walking around. I usually tell my patients to go to a Marathon Sports or like a Michelson's or something, and try on a number of different pairs like back to back and see what feels good and what they feel the best walking in. But I've seen a lot of, patients coming in with these like really thick Hoka's and it throws their balance off more. And they feel better once they're in something a little lower profile.
Would you recommend a podiatrist to be consulted?
I would say if someone's having a lot of foot pain, like kind of confounding the neuropathy, a podiatrist can be a great person to consult. Or if you have like a lot of arthritis in the feet that makes, wearing a traditional shoe difficult, like if you have like bunions or like a more complex foot, that can definitely be helpful because they can prescribe like an orthopedic shoe or something like that. So a lot of times when at least in my experience, what I've seen when people have neuropathy is they feel much more unsteady when they're standing still as opposed to when they're moving. They're like, when I go on a walk and I'm going, I feel great. But then if they're trying to do things like balancing with their eyes closed, they can feel a little bit more unsteady. When you're walking slower or taking shorter steps, it might be that you're standing, a little bit longer on one foot. You might feel wobbly because of that, or even just slowing down and just kind of forces you to be on one side a little bit longer. And momentum can kind of carry you forward too when you're walking at a more brisk pace with long strides. Any other questions? Hello.
I just wonder, is there any lower back pain related to the
Neuropathy?
Yeah.
Yep, so if you have an impingement in like a nerve in your lower back, that can absolutely cause sensation changes in your legs and in your feet. And so that's why part of the diagnostic process is really important, because if it's something where it's just like, oh, you have a herniated disc and maybe you would benefit from some type of decompressive surgery or an injection of some kind, that's much easier to manage than like a systemic cause for
I've seen bicycle cranks, the stationary bicycle crank.
like the little peddlers.
Yes,
Yeah.
and I've seen those used just for general health
Yeah.
and circulation. And I'm wondering to what extent, say, the lower leg, if use of that of a device.
For like circulation and mobility.
Circulation, your ankles.
Yeah, I would, they're not gonna hurt, and I think for someone who is primarily very sedentary, they're a good introduction. I would say I wouldn't replace walking with that, but it's something that is good to kind of keep the legs moving, especially if you're spending a lot of time sitting down, not moving around as much.
Does there want to be effort involved, or can you use those electric things that just crank away seemingly?
You want there to be a little effort involved so that your muscles are actually pumping. So if your legs are just kind of along for the ride, it'll be good for stretching and range of motion if you're very, very stiff, but it's not gonna get you stronger or anything like that. Yeah.
Yes, a relationship between spinal stenosis and
Yes, spinal stenosis will put a little bit of compression on your spinal cord, which can cause sensation changes in your legs for sure.
do you recommend shots?
A lot of people will get shots if they have a lot of pain. I would say if you don't have pain, there is a downside to getting cortisone shots because it can cause weakenings of the tendons and muscles in the area. So if you have a lot of pain, they can be beneficial. But if you don't have pain, I would. That's a great question for like a neurologist or whoever manages like your spinal stenosis.
Can you comment on the benefit of chiropractic in adjusting the nerve compression?
So if you're having a nerve compression because of like an impaired spinal alignment, I've had patients have success with going to chiropractors. The only issue with going to a chiropractor is that unless you're doing things to strengthen the muscles that support your spine, you're going to fall back into the issue, like the underlying issue is going to keep coming back. So you have to keep going to the chiropractor to keep fixing it. So I usually recommend if you're going to go to a chiropractor, supplement it with physical therapy as well so that you can get stronger to support your spine a bit better. Anything else?
Tai Chi.
Love Tai Chi. It's the best. There's a lot of research that has gone into Tai Chi. It's really great for balance and strength because it's a lot of slow motions that involve weight shifting, balancing on one foot. So it's excellent. It's gentle on the joints too. So it tends to be well tolerated by people. Anything else? Sensational. Okay. I'm gonna pass the mic back to you.
And with that, I just wanted to thank Meredith for joining us today.